proceed, because obviously the whole point of doing something like this is that so we all benefit from it. Obviously, I have a lot of training and knowledge in this area, but as you can see by that slide, there's 2 points to even doing this. One is that it's not as scary as you think. Even if you know nothing and look at your blood test results, it's completely terrifying or completely nonsensical. It makes no sense because they're mostly in acronyms and the way that they present. It's like another language. It's like French if you don't know how to speak French. So I just wanted to break that myth, demystify the notion that blood tests require you to have a university degree in medicine. You don't. And I know this because I've worked with high school students who come to my clinic and they pick it up in 5 minutes. So it's not rocket science once you know what a couple of the things mean. And the interesting thing is, mostly you'll have the same tests your whole life. Only if something really unusual happens that you will have a different new test that will require you to then learn what that means. But once you pick this up, what we're going to go through in the next couple of weeks, you are armed and empowered with knowledge that then you can use to talk to a health practitioner, specifically a doctor or anyone else like myself, in a way that you can help steer the direction of your own health. That's what all this is about. And I'm not, and there are many people that just don't want to know. That's fine. And it's not a judgment on that. But
that was the last 10 years.
What was that?
So that was me for the last 10 years.
Yeah, right. So eventually, maybe you come around to the fact, geez, it might be useful to me to know a couple of things about my health. And you know, particularly since the way things are going, you both could be on this planet for another 50 to 100 years. That's not a joke. That's true. So if you're going to be around that long, get to know. And also the way that the current medical model is, because doctors are really maxed. They're really under the pump, as you can imagine. I don't mean just with the coronavirus thing, but with in general. So the current medical model means that you're lucky to spend more than 10, 15 minutes with a doctor when you go to see them. So that's very different from the system and the model that was in play when I grew up, where the doctor would come to our house, spend an hour and a half there, and get to know and did know our whole family and a whole history of everyone in the family. That can still happen, of course, but you need to find a doctor who's got that time and be able to communicate in a way that you can get those things that you need and you want and that you've identified as important to yourself. And that's what this aspect of the next week or so that we're just going to go over, that's the intention, so that you'll come out at the other end armed and empowered to be able to take some more charge of your own health, and then with that knowledge be able to have a more meaningful conversation with a doctor or any other health practitioner. Does that make sense?
It does. Yeah.
That's great. So it's all part of the strategy for health in general. So why don't you start off, Michael, and then every now and then I might interject. Or we can do it this way. You let me know. Let me just show you something. Just bring up that slide again.
Understanding what I think is my understanding anyway, because no one's told me how to read it, but I can see how it works.
That's fantastic. So can you, just before you start, can you read those things I've got there on the screen at the moment?
No, I can't. I can see something.
Oh, yes.
270 something per milliliter.
Is it because the text is not clear?
Oh no, the one on that is, I can see it.
On which?
On the screen.
You got better eyes than me.
Right. So Anne can see it. Can you read even the bottom part, Anne?
Yep. From the 8th of March 2014, active B12, is that right?
Yeah, that's right.
Something or other.
And
Yep.
is it clear? Is it focused properly, the screen?
It is, yeah.
Okay. So we've just identified that maybe Michael needs to get his glasses checked, or that they're used for reading.
Well, yeah.
No, I'm not. I'm not
got
showing you, because sometimes.
I know you're not, but I just.
Next to the hearing aids, love.
I've got about 10. I've got about 10 pairs of glasses.
Right.
They're all different strengths.
Yeah.
Gotcha.
Gotcha.
These are the +3s, I think.
That's fine.
Which I've had to upgrade to.
That's fine.
But yeah.
All right.
I don't have advice.
So yeah, go ahead. We'll intersperse the slides and see how we go.
Okay. What I found amazing, considering my history and my abuse of my body, was my liver function tests, and they're very good. They're very good.
Can you read it out?
Yeah, all in the range. Okay. All but, well, the liver function is with the protein at 7.9%, and it's meant to be 60 to 80%. The albumin is 38%, from 31 to 47 is the correct dose or the correct amount. Calcium in the glomerular is 41 out of, yeah, all the things down to the alkaline phosphates are all within range.
Yep.
Alkaline phosphatase is 90, and the recommended limit is 30 to 110.
On the thing, but not this one. So, yep. No, hang on.
See how it's in different sections.
Yeah, okay.
That's the back of it. That's just the liver function test. That's not the blood results.
No, that's right.
Anyway.
What the liver function? Let me just explain this to give an overview of your results there. So you are reading out what they call the general section you're reading out is called biochemistry. With biochemistry, it's an interesting thing because it looks into different organs of the body. But it first of all usually assesses what's called the electrolytes, and that's what you were reading out a moment ago, Michael. So, but yeah, in regards to those parameters that you were just outlining, the most important ones are actual sodium and potassium. So they have to be in range, because if they're strange or even very close to the edge, usually that's quite serious, and you would probably actually be in hospital. So for instance,
read you my
show me what are your sodium and potassium.
Okay, that's at the start. The sodium is 5 points off the recommended high dose, which is sodium says 140, and the right dose is 135 to 145.
Well, that's exactly in the middle, so that's good. And potassium?
Okay, and the potassium is 5.1, and the one is 3.5 to 5.2.
Right. So interesting. So two things around that. So we'll just go. Every time you bring up something, you've just brought up something, we'll use that as a learning exercise, if that's okay. Is that all right?
Yep, that's fine. That's
okay.
Good.
So Anne can see the that what I've got there on the screen. So let me just, Michael's already pretty much on top of it, but I'll just amplify a little bit what he's saying there. When you read a blood test, what you see up there on the screen and what Michael's got there in front of him in his papers is a standard way of presenting a blood test. And there are 3 parts to it. On the left-hand column, you'll see the name of the thing that they're testing. In this case, we're talking about sodium and potassium. Then the second column, sometimes they mix the columns order around, but normally the second column then shows you the result, right? Is that the same for yours there, Michael?
Yeah, that's correct.
Yep. And then with the result, it's got the units. The reason they put units is because units in Australia are different from units in America, for instance, and different countries. But there is usually only two forms of units around the world, and some countries, it's sort of like metric and imperial, so to speak. So that's the units. And then the third most important column is what's called the range. Now, it's important to understand that range because Michael just read out his potassium range is 3.5 to 5.2. Whereas if you look up there, Anne, you'll see the range on this person's results is 3.5 to 5.5. So it's a different range. So why is that? Does that mean the lab was just, messing around on that day? No. It means that different age and different gender and even and pregnancy status or lactation status or even menopause will affect the range. Important concept to understand. So you can't just compare ranges between, say, Michael and yourself because he's a male and you're a female. But having said that, it's not like the ranges is if you came from another planet. It's not that different. So it's similar. It's pretty similar. Now, let me just clarify, because this can be a point of, in some degree, this is why doctors play it close to the chest in regards to interpreting blood tests and not letting usually clients have their own blood tests and interpret themselves. This is why. And it is because you need to understand what that means, or what does a range actually mean. Do you want to give your interpretation of it, Michael, for instance? What do you think it means?
Oh, I think it's the range is the upper and lower level.
Yeah, but where does it come from? How do they get that?
How do they get it?
Yeah.
Through scientific tests, I suppose. Through time of testing people's blood. I don't know. I wouldn't have a clue.
Yeah. That's all right. You, Anne, any idea?
No, I've got no idea.
Okay. So obviously they tested you and they came up with a value for your potassium. What did you say it was? 5.1, Michael? Was that right?
Potassium was, 5.1.
Okay. So a range means simply this. It's a population range. It is not an absolute, meaning over time they've tested thousands and thousands. Well, these labs have actually tested millions of people all over Australia. So they've tested thousands and thousands of millions of people, and then statistically they calculate that range. It's a statistical population-based range. And in reality, they use that as a general guide that you are, in inverted commas, normal, meaning you fit in to most of the rest of the population.
I definitely don't fit in with the rest of the population.
And it's what doctors use to be able to scan how normal you are in regards to these parameters, these blood test parameters, within a second. A doctor can look at this page and say immediately his brain goes normal, not normal. Pretty much. It's quick.
He's prejudiced.
What's that?
I say he's prejudiced.
Yeah.
Or he's judging.
Exactly. So it's useful for a quick analysis. And then, Anne, if you can, just to add, because there's some other information on this on the screen up there, see that there's two things in there in red.
Yes.
Yeah. Now, that's right. So usually in a blood test, if you are out of range, and you've indicated a couple of things there, Michael, on yours that might be out of range, either the blood test shows those results to be bold or red, or both. Is that how yours are shown, Michael?
No. No, they're showing either a plus or a minus, or an upper or lower arrow, or minus, or, you know, what's that called? What's it called?
The arrow that goes that way.
Or the arrow that goes.
Oh, less than, yeah.
That, like 9, got it.
Yeah,
Less,
okay.
yeah, less than or more.
Yeah, that's right. So on this result I've got on the screen, they make it super clear. They make it in red, so it jumps out for the doctor, and they put an L or a H next to it, meaning it's low.
Well, that
What's
here
that?
too. Different pages are done differently.
On yours?
Because I've got quite a, yeah. So
Yeah.
one page has got like what you said, and then the other page has got like H or L.
Okay. Well, what that means is different labs. Like there's two. Well, in actual fact, there's about 4 labs in Armidale, but the 2 main commercial labs, Douglas Hanly Moir or Lavity, and that's where Anne will be going on Monday to Douglas Hanly Moir. But there's also a lab at the hospital, and I think there's one associated with the university as well. I'm not sure whether that's still happening. So different labs will have different ways of showing the results, but the results say the sort of the same thing. And sometimes you'll even get, even if you're a male and at a certain age, you'll even see the labs have slightly different ranges as well. So it might only be out by 1 point, you know, instead of 5.5, it might be 5.4. And that's because they've calculated that range on their population that they've tested. So that's how it works. That's a lot. I know that's a lot to take in, but if you get that, then that rule, 3 things, the thing you're testing, the result, and the range, that's nearly how all blood tests are shown. And then the next sort of leap in knowledge or understanding or learning is what these things actually mean. So if you're looking up on the board there, Anne, you'll see there's things halfway, well, the thing's called EGFR. What the hell's that? It could be a part of Michael's motorcycle. There's things called LDH, AST, ALT. What the hell are all those things? So they either like to work in these acronyms or abbreviations, but this test that you're currently looking up there on the screen and what Michael's been reading out is one of the 2 core tests of blood tests. And I actually got my degree earlier on. I have a degree in biochemistry, and that's what this test is called, biochemistry. So it tests parameters within the blood that reflect functioning of certain organs in your body. So this is a window, biochemical window into your body. And that's actually why I really like biochemistry. That's why I did it. It's sort of a snapshot. And of course, there's a lot more to this, but it's a way of looking into how the cells and then, of course, the cells within an organ are actually functioning. Keep in mind, though, I'm just going to introduce a couple of things. So, and again, this is knowledge that doctors have. Your blood tests, the ones you're seeing here right now, or the ones Michael's reading out, can also have variation within a 24-hour cycle, depending on what's happening with you. So if you're sick, like you've got a cold or a flu or something else has happened, or even, this is important to know, even if you're on a strong medication, like antibiotics or something else, that can affect these results. So those other temporary things can also affect these results. So that's important to know as well. Right. Are we okay? Not too overloaded?
No.
Are you okay, Anne?
Yeah, I'm good.
You're right? Okay, good.
Yeah.
I can only see you as a postage stamp size when I put these slides up. So I can't really see your facial expressions. Yes, I can see Michael waving his hand there, but go, Michael.
Yeah, hello, sorry.
So let's finish with Michael's biochemistry results. So let me just jump ahead, Michael. Do you have a test called Egfr on your results, biochemistry?
I do.
And what is that?
It's not Egfr, it's just GFR.
That's fine.
It's an estimate.
That's fine.
It's an estimate.
That's right.
And it's that my level is.
What is that?
That one, less than 90, or is that more than?
That's greater than, yeah. If the arrow points to the right, it means greater than. If it points to the left, it means less than.
I thought that. Wasn't 100% sure, but it's been a long time. So it's more than 90, and it's got milliliters minimum. Is it milli or
That's right.
microliters?
That's right, milli.
1.73 milliliters squared. Now I don't know why they did that.
Yeah, that means per milliliter per minute. That is what you're reading out there. M usually in you don't really have to pay attention that much to the units, but just because you did, M usually means milli, and the U that you see there in some of your results, although not all of them, a small U means micro. But what is the reference range on your results, Michael, for the GFR result?
It says minimum stroke 1.73 m squared.
No, that's just the unit, but to the right of that, it should have the range there, or the optimal range.
That is to the right. My body had more than 90. It says.
Okay, that's fine. Maybe they didn't publish that. I'll tell you where you are. First of all, do you know what that means?
No.
Okay, I'll tell you. EGFR stands for estimated glomerular filtration rate. Yes, it's a mouthful. Not expected to memorize that, but it's useful to know what EGFR means in the context of things. It's a surrogate marker for kidney function. How well is your kidneys working? And the main function of your kidneys is to filter blood. That is, there's other functions, of course, but that's one of its main functions. The result of this test, and you got greater than 90, indicates that your kidneys are pumping and filtering fantastically.
Really?
Absolutely.
Oh, I thought that would have been.
Yeah, absolutely. So again, just keep in mind that all these tests are a general quick snapshot look in. So the range is greater than 59, or let's say 60. Let's round it off. They might not have published that on your thing there, but and you can see that on the screen there. It says greater than 59, which means that if you get less than 59, if your EGFR value goes less than 59, it means something is definitely concerning about your kidney function.
Could you just explain to me or tell me what? Hold on a minute, I just grab a pen.
Yeah.
Which you'll have to do. What EGFR stands for again?
Yeah.
So what?
It stands for estimated. The little e stands for estimated, meaning they're estimating it. Pretty accurate, though. Glomerular.
Glomerular.
Filtration.
Filtration. Yeah.
Rate.
Right.
Okay.
Very good.
Yeah. Now I'm
Thank
going
you.
to just jump to a different slide just quickly, and just, can you see that?
Yeah.
Yeah.
So
The glasses on.
this is designed for the public. So if you go to that site, it's pretty easy to remember, labtestsonline.org. There's an Australian version and there's international versions. But if you just type labtestsonline.org, for instance, and you forget the AU, you'll still get there. So that site will go into detail of what we're discussing today. So if you go to that site and they want you to pick a lab test, because they've got thousands almost up there, if you type in EGFR, it'll come up with what that means and how to interpret your result. So this whole website, we're covering some of the basics of what is extensively covered on that website. So if you forget down the track in a year's time, you get a result and you forgot what we were talking about to some degree in this class today, don't stress. You can either just type in lab tests and it comes up pretty high in Google straight away. So just letting you know. My lecturer, my professor, when I did nutrition medicine for 4 years, he said, you're not expected to remember everything because you can't. The level of knowledge and information that's flowing through on a daily basis in regards to research and health and science is astronomical. I don't know if there's any brain on this planet that can hold all that. So he said, though, what you do need to know is how to find the information. That's important. So that's an important skill to have, so don't stress if you can't remember everything. Like we're going through a lot of information, for instance, today. It's what would be more useful and beneficial for both of you, because you're coming at it from different levels as well, is to understand what's being said rather than memorize what's being said. Okay, so jumping back to that screen. So Michael's, and we'll go through yours too, Anne. So I'm giving you some overview, so when it comes time to go through yours, you'll already have a bit of a head start as well. So on this, I'm just steering in some ways your results there, Michael, just to keep it under this umbrella of biochemistry. So after the EGFR, we come into a whole bunch of things, as you were reading out before, total bilirubin, alkaline phosphatase, and then gamma GTT, and then usually those three things, the LDH, AST, and ALT. Do you know what they are? Those 5 things I just read out?
Some of them, yeah.
Well, they're all pretty much in relation to, as you said, the start, liver function tests. So in other words, these parameters, like the EGFRs looking into kidney function, these 5 parameters, to a large degree, are looking into liver function. So normally, if you're hitting the piss pretty hard, or even if you're taking a very strong medication, or if you have any sort of hepatitis, or you've got a fatty liver condition, which you can have without drinking alcohol or taking drugs, then these parameters, these 5 parameters, can be elevated. In other words, your results can be out of range. And what that basically simply means is that whatever's causing the situation whatever's causing these parameters to be raised is actually damaging the cells in your liver. And the cells in your liver, I know this sounds scary, then rupture, they sort of explode. And when they rupture or explode, they release their contents into your bloodstream. And the contents that are released are in essence, at least the LDH, the AST, they're enzymes. they're acronyms for enzymes in your liver cells. So when there's an insult, a toxic insult, a damage to your liver, the liver cells rupture and they release these enzymes into your bloodstream, and then you get this test, and the test will show that they're too high. And to put that into context, some people who are drinking a lot of alcohol, or they've got hepatitis, or even another thing called hemochromatosis, which is a genetic disorder of high iron, can cause these results to go into the thousands, not just 5 points over, hundreds to thousands of times higher.
Can I ask a question?
Of course.
If your liver has turned cirrhotic, is your liver able to heal from that?
That's a really good question. There's I've got personal experience. I've had liver situations in my life since I was quite young. There's first of all, why are you asking that question? Are you concerned about your own liver, Anne?
Because before I had treatment for Hep C, the doctor said, because I went to the doctor and just in general conversation, I mentioned that my feces were yellow.
Yeah.
And he had me go and have a scan of some sort. And then he said that my liver was turning cirrhotic. So I needed to have treatment for my Hep C.
Yeah.
So I'm just wondering, does that, because I had the treatment and it cleared the Hep C, but
Right.
I'm wondering, does that mean that my liver healed as well? Does my liver heal or?
Okay, that's a really good question, and thank you for being open and putting that into context, because hepatitis C is an unusual virus. There is no vaccine for hepatitis C, so it's unusual. It's not like hepatitis A or hepatitis B that can have vaccines. So, basically the hepatitis C virus lives mostly in your liver, and that's then where it causes most of the damage. So good on you. Did you take the Epclusa or one of the more recent antivirals?
No, it's on the interferon and the Rivian.
Right. And how long ago?
Oh, probably 8 years ago, 9 years ago now.
Right. And have you had recent tests to confirm it's still cleared?
Last time I think I was tested was when I was incarcerated, so probably 4 years ago, 3 years ago.
Right. So, I just need to say something here. When we get does David know that, by the way, Dr. David Young?
I don't know. I think so. He would know from the last time I was here because I would have mentioned it.
Okay. All right.
Yeah.
So, all right. So all the blood tests that we've just ordered for you will actually show a lot.
Yeah.
In some ways, start to answer that question you just asked. I mean.
Yeah.
So that's partly that. And the liver, and in actual fact, many of the organs in our human body. This is quite profound. This is interesting that you brought this. This is really interesting understanding, important understanding. Many of the organs in our body are extremely resilient to both damage, but also in their capacity to recover. So the first step to any recovery, and I'm talking here about the organs, is to remove the point or the source of the insult. If you have a little cut on your hand and you keep sticking your finger in it all the time,
yeah,
it's not going to heal. It's going to go red. It's going to go puffy. It's going to go blah blah. It's going to, every chance it'll just get worse. So it's the same principle. So whether the insult is through a virus or a chemical or a genetic thing or even a nutrient, like I was mentioning hemochromatosis, if your iron levels are too high, that'll cause an insult as well. And that's an essential nutrient. So, and we've mentioned it. What was that, Michael?
I say my cousin's got that, where he has to give blood every week or every month or whatever it is, so his iron levels aren't too high.
Yep. That's it's called phlebotomy. It's where they actually take your blood. Then to be more specific about your question, there are gradations of damage to the liver. I'm getting back to the liver. You asked the question about cirrhosis. Now, cirrhosis, it's unusual for a doctor to say your liver is cirrhotic, because that's like...
If it was turning cirrhotic.
Yeah, right. That would be more accurate, because that's a nasty thing to say, almost. So when they test your liver, and there's more, by the way, Anne, to answer your question, you need to go, and we'll follow up on this. Just write this down and just flag this in the back of your mind, because you're taking advantage here of quite significant experience I've had recently too. So in Armidale, there's tests, and they're actually done by the people from Tamworth that do scans. They're not blood tests. They work in addition to the blood tests. And you may have already had this, where it's sort of like an ultrasound. It's a form of ultrasound where they can actually scan it's not intrusive. It's if you've had an ultrasound, it just feels cold on your tummy and stuff like that, where they can get some idea, not 100%, but a good idea of the gradations of, you might say, health or injury to your liver. And there's temporary injuries, and then there's like a fibrosis. A fibrosis means that the tissue in the liver, it's like a scarring. That's the best way to put it. It's like a scarring. And then the next level on is cirrhosis, where it's more serious. And then if that's not stopped at that stage, the prognosis is not good. You then end up, after cirrhosis, is basically liver failure, meaning then that you either have to have a liver transplant or the situation's just not good. So the good news is, if you remove the source of the insult, and that's why they work so hard to come up with these medications to get rid of the hepatitis C virus. They've worked very hard on that. If that's successful, and you're doing other things like, please from now on live a healthy lifestyle, eat well, do good things, sleep well, all that. Don't put anything in your body that's is not useful, because the liver is an interesting organ. Virtually everything, all the blood nearly that in your body every day has to flow through the liver, because it has to process both toxins but also nutrients. So it's a pretty busy organ, and it plays an active role in so many things. So does that sort of answer your question?
Yeah.
You okay?
Yeah, good.
Okay.
Okay.
All right. So we'll, over the next few weeks, because some of this information can be disturbing.
I know. I know. Just think of empathy.
What was that, Michael?
Oh, as you were explaining that, I was only thinking to myself about Anne's empathy and how she is a little bit emotional sometimes.
I am, but not today. I'm having a good day.
Yeah. Well, I mean, you can think about these things later on. It might bring up some concern. So worry is useless. But being concerned can be constructive if you follow through on the concern. And what I'm outlining here is a situation, a step-by-step situation to find out because the more you know, this is my understanding in life, the better off you are, because then you're more equipped to do something about it. If you just stick your head in the sand or hide under the pillow or your doona, well, it's not good. It's, you know, it's better to know, even though it's uncomfortable sometimes to know things. But if you have a SPAC attack, if you get down about something, fine, let it work through you, and then get back up and move forward. And that's what we're here for. That's what and I'll do the best that I can to help with that. What else is on there, Michael? You are reading out things like total protein and albumin. Often in the biochemistry, you have cholesterol and triglycerides. Not always. I don't know whether yours got that on there.
Oh, I probably should have started with that because I didn't realise that's probably the first page that was a heading.
Well, sometimes they put cholesterol on a different page because the biochemistry only measures the total cholesterol, but cholesterol now has like at least 4 parameters, and usually it's lumped in with triglycerides under there. So, do you have any of those tests results?
Yeah, I do. And I'll read you the bottom bit first because it says the above reference intervals are the lipid lowering therapy targets for the primary prevention of cardiovascular disease. The secondary prevention recommended target is 1.8. So my results are cholesterol is 4.6.
Yep.
And it's below 5.6, which is meant to be the recommended intake or whatever.
So you're reading out the total cholesterol, right? That's what you're reading out?
Yeah.
Yeah,
right. What's the reading? Does it just say below something, does it?
It's below 5.6. Mine's 4.6, it's 1 point below 5.6.
That's fantastic. That's great. That's a good result, by the way. And what about triglycerides?
Okay, mine are 1.9 and it's recommended below 2.1.
Now that's interesting. Can you see the screen there, Anne? See triglycerides is right on the bottom. Can you tell Michael what the range is there?
Yeah, 0.5 to 1.7.
So it's obviously, according to this person's result, I can't remember, this could have been a woman or someone in a different age category to you. So it's a good example that you can see that the reference range is different there. It doesn't mean that that's wrong. It just means that this person's, that population group is different. So 1.9 is on the higher end, as you can see, even if you look at your result, Michael, the upper level is 2.1, I think you said.
That's right. Yeah.
And you got 1.
So what's the triglyceride? What is it?
What do you think it is? Either of you know?
Maybe that it helps reduce the cholesterol? I don't know.
It's basically fat. Glyceride is a fancy word for fatty acid, fat, and tri means 3. So the fats that move around when you've eaten food or when there's other sorts of metabolism going on, they form this molecule, and it has sort of 3 tails without going into too much detail. But that's what a triglyceride is. It's basically a measure of fat in your blood. So what's confusing for people though is that you can have elevated triglycerides because you're actually eating a lot of carbohydrate as well. And that is because carbohydrates can get converted into fats, particularly if they're in excess in your body. So and it's also, in some ways, it's a sort of, it links in a little bit what we're talking about with the liver function earlier on as well. So when you have a result that's getting near an edge, it's useful to flag that and then test again. So and we'll leave this here for today, but it's amazing how much learning that we can get just from this one basic tests. We haven't even gotten on to the core blood test, which is the blood and the hemoglobin and all that. So, but here's one last take-home message. And there's two things to it, though. One is that a blood test on its own, like either what you're seeing here on the screen, and can see that on the screen, or what you're reading out there, Michael, on that page, in some ways, you can't rely on it. You can't put a lot of confidence in it in relation to long-term health. Why am I saying that? It's because you could be having a bad hair day. Well, not so much in your case, Michael, but yeah, I don't think you ever have a bad hair day. So what I'm saying is, I said this before, if you're sick or there's other temporary things happening with you, it can affect these results and skew them to that thing that's happening to you. So results become more significant. I don't know whether you've got any of them there, but if you have a test last week, you've had one last year, and you've had one the year before that, often they show the results in that serial way. They'll show them next to each other. Your result 2 years ago, 1 year ago, and 1 week ago. And that, you might have some of those. That's where blood tests become very powerful. In other words, it shows a progression of things, and it shows historical snapshots. You know, you might have been going through a period when you were drinking a lot. So then if you look at the blood test around that time, you'll see those parameters saying those things and reflecting that. Or you might have got a stomach bug and you were taking these intensely powerful antibiotics. So that'll reflect to some degree. So what I'm trying to say here is that if you've just got one blood test, don't try to extract all the meaning of everything that's going on in your body just from that one blood test. So for instance, if Michael's triglycerides are a little bit high or going towards the high, then you would want to test that again, say in 3 months' time. Maybe you'll learn some things, or we'll talk about some things in the nutrition class that'll make you change your diet, some aspects of your diet, or your behavior, meaning how much you walk or whatever, or how much you sleep. That will then reflect when you retest in 3 months' time and show us, so it can normalize those things. So that's that last thing. And then as part of that, it's important, because I don't have it on here, but you'll see it on yours, is the date of the test. So that forms an important part. When was the test done?
Yeah. I've got a little, like you were just saying, I've got a little snapshot here of 2018.
Right.
It's not, all it is the what we did before, sodium, potassium, chloride, all that kind of stuff, down to the union gap and the GFR.
Right.
So yeah, a little snapshot, but it's very, very close to what it is now.
Right.
A couple of things.
And that was 2018.
Yeah.
Right. Great. So let's do, if you are both okay with this, you're not too overwhelmed, hopefully from today, we can continue this next week, and maybe Anne will have her results by then.
Yeah.
And also, if you're able to, don't worry if it's too hard or you can't do it, but if you're able to get any of your historical blood tests, that might be useful as well.
Yeah.
Now,
I'll try.
Yeah, if you can, you can. If you can't, don't worry. At least we'll start somewhere. I'm sort of like putting a lot of detail into it, as you can tell. And don't worry if you can't absorb or retain all of this stuff. But as we talk about it more, and every now and then, once we've had this class, we can interject some of this stuff into the normal nutrition classes. And it gets interesting to then when you start measuring nutrients like vitamin D, folate, B12 and iron and other things like that, because you can do all that too with the blood tests. Those things aren't really shown here in this particular one at the moment. So, yeah, are you okay? Shall we leave it at that? And
We're good.
you're probably extremely relieved.
You've got a mother's nature, Hart.
What's that?
You've got a mother's nature.
Thank you.
Ask Leanne, is she okay?